Hey, my coding family, how's everybody doing? Good to see you guys. Hey, TikTok, how's it going? Hey, YouTube. How's everybody's week been? Hey, TikTok family. Let's see what's going on chat. Hey, Go-Kart. Hey, Violet. Good to see you. I didn't realize I wasn't subscribed. Thought once I joined, yeah, I thought it would be too also. Hey, Go-Kart. Looks like you're still subscribed though, Violet. You still got a star beside your name. Thanks Sham and MP for subscribing to the YouTube channel. Your guys' support is keeping this thing afloat. I've got 8 people on and 5 likes. Hey, TikTok. Thank you for the taps on TikTok. I got 14 on. Let me bring up today's lesson. I got the right one up. Let's see. Let's see. Let me see if I got the right one up. Word. I do. I have the right one up. But let me make sure I've got the camera working right.
Honestly, this shit just keeps getting funnier and funnier to me. So.
TikTok's up loud. All right, where are we at? There we go. Make sure I can see the live on my other TikTok account. I'll get this up. How's everybody's week been? I was a little sad. This week. The live didn't work so well on Monday, so that was depressing. We had some technical issues, and then Wednesday's thing at one of the schools was super depressing, and then today I think somebody had a little tough at a school too today, but goodness gracious. I hope everybody's okay. I hope today's lesson doesn't have any more technical issues. Y'all let me know in chat if y'all have any questions, any codes that are giving y'all problems or anything today. Hopefully y'all are liking some of the new content. I got some new videos out that are really cool. At least I hope they're helpful anyway. If you guys had a practice exam question and these were your available answers, what would be the fastest way to look through the question to eliminate or pick an answer? What one word would you be looking for in this situation? If you had, get this drawing tool out. This was A, this was A, this was B, this was C, and this was D. What would be the fastest thing to look for in the certification exam question to help you eliminate some words really quickly? Thanks, Go-Kart. Thanks, Fagan. One code seems to have trouble with the back pain and finding the main term to look for. Ah, pain. we're going to go look up pain. And then we're going to figure out, are we cervical, lumbar, sciatica, thoracic, those kind of things. That way we know where we're located after we find pain. Usually when you're looking up diagnosis codes, it's the last word in the sentence, and you start from there and work your way backwards. Look up pain, and then you look up lumbar or thoracic or sciatica, depending on what the physician says. Hopefully that's helpful. Anybody got a one word? What would you be looking for? The fastest thing you could look for is to see if your patient was discharged. If you go down to the bottom of the example question, go down to the last sentence and look in that area. If your patient was discharged, you know that it would be A or B. And if they were not discharged and they were still wherever they were at, you probably know that it would be C or D, right? That would be the fastest thing to look for if these were the available answers in a question. Go look to see, was your patient discharged? This one is ER, of course. This one's your admit and discharge all in the same day. This one is your subsequent hospital visit, and this is your admit hospital. So if your patient was discharged, you know it could only be A or B. And that would help you out the fastest. Tricks like that will help you get through this exam fast and efficiently. You'll be getting a correct answer, right? So let's do a do-over of the questions that I had on Monday that we did not even get to. I had some really cool ones for cardiovascular. Let me make sure I get rid of all these little marks that we had on there. Wait, hold up. Hide all the ink marks. Delete all those. There we go. Here we go. So if we were doing the process of elimination on this, just looking at the answers, just as answers, I would get rid of B because it's not like the rest. It does not start off with the 15 code, right? All the rest of the answers do start out with the 15. Sometimes it's an answer where the outlier is the answer, but probably this one looks like they're all 15s. Then if I was looking at the answers, the next code is definitely this 14, but we need to know, what would it include the 59 modifier or be by itself? It probably would include that 59 modifier, and since those two are similar, C and A start out with the very same first two codes with this, that second modifier being the same. It's great. The only difference is the radiology codes. Would we do a 41 or a 41 in radiology, or would it be more likely we'd do a 43 and a 74? We probably wouldn't repeat the same code twice, so I would pick C as my answer and move on with my next question if I was doing it without looking at the question at all. That's how the process of elimination would be for me. But if you want to do the question so you know whether you're right or wrong. Let's go look at the 14 and the 15 code. 360. 360, 15, and a 14. They're both selective catheter placements. One segmental and one does right and left. We placed our catheter into our right vein that went into our left and right pulmonary artery. Does that mean it's a selective catheter placement into our left and right pulmonary artery, which is our 14, or is it a selective placement that goes into a segmental or subsegmental pulmonary artery? The 15 is segmental or subsegmental. 14 goes right into the left or right pulmonary artery. It is an or. 14 is an or also, not both. But what we did is we went in through the femoral vein down in the leg, and then we branched off into our pulmonaries, right? This is what we did if we have our stick person, you know, who's tall. And then we have arms, and then we have a head up here. So we went in through one of the femoral legs, then we went up and branched into the left and right pulmonary artery. If we had done 14, it's an or, not both, but it does have the words pulmonary artery in it, and it has the right and left pulmonary artery in it, so that kind of makes you want to do like a word search, and then you see left and right pulmonary artery in it, but you forgot about your right femoral vein before it. So this one would be direct into the right or in a left pulmonary artery, way up here where the pulmonary arteries are. They do not start at the femoral, the leg. So you know it has to be 15. Long explanation for that, but you know you're going to be 15. The only difference is, would we 50 modifier it or not? Our 50 modifier is bilateral procedure. And this 15, because it's segmental or subsegmental, because we started out below in the femoral artery and then we segmented off into other two branches, it's already considered, you know, right, left. We're going to go wherever. We don't need to add. If we went in at the right femoral vein and then we went in on the left femoral vein also for this procedure, then maybe. But I still think we probably code this code twice with the 59 modifier instead of bilateraling it or whatever. But yeah, we definitely Don't need that. We just need to mark which one we went in, which was the right. So that tells you right away, as soon as you get to these modifiers, that you did the 15 into the right for moral. And it's the only answer with the right in it anyway, is again C. I'm just telling you that you jumped in here to let you know that I passed my exam today. Thank you so much. Once I started doing your lives and watching all your videos, everything clicked. Awesome. Who was that? I started reading without looking at the name. Teresa, congratulations. I'm so happy for you. That is wonderful news to hear. Take a picture of the screen. Thank you so much for jumping back on, letting me know, coming all the way back. I'm so happy I made a difference in your life and that the videos helped out a whole bunch. Congratulations, that's awesome. Yay! Anything on the exam that you were like, oh gosh, she's never told me anything about that? Or did you actually see some stuff that I've actually said was on the exam or helped prepare? Did you get the question with the intersex code in it? A sex change one, that kind of stuff? It's kind of interesting. Congratulations, congratulations. Oh gosh, I'm just starting out studying. Don't worry, Sterling, you're going to be fine. Don't worry. You're going to be fine. Any other questions on this question? Hopefully that is helpful. For this one, here's the fancy rationale on this one. It was easier than I expected, and I finished with an hour and 15 minutes left. No sex change. Awesome. Great, Teresa. That's wonderful. You must have had exam like, I don't know. I wonder if they build them individually now, because now that they're all online, they can actually, in reality, build any exam and make them all unique. But that is awesome. Was it the first time you took the exam too? All right, our next one is 2 pages long. If we were doing the process of elimination, what do you guys think the answer was going to be? We're going to have, we got to know if we're a 52 or an 80, 58 or 52, probably, because got to know if we're one or the other. We got some with symptoms, and then cardiovascular. Would you do symptoms before cardiovascular? It's kind of interesting. Some with radiology, most without. One with the hip picks. We need to know if we're going to need that symptom. That diagnosis code, we've got the 19 or the 10 to know. Or we have a 95 versus a 98. It's probably the 95. Since the 95 is in 3 of the answers. So that'd make me want to get rid of C. So, if I got rid of C, I like my 95s. still got to know whether I'm a 10 or a 19. But if I get rid of the other 19 and just keep the I-25 10s, then it's a difference between B and D. And it's whether you're going to have 2 CPT codes or 1 CPT code. So then I'd like B. What do you guys think? It was her first try. Congratulations, Teresa. That is awesome. So proud of you. Wonderful. Good job. All right, let's go look in our book and see what our differences are between the 93452 and the 58. You want to get in a habit of always looking up the differences between the codes before you look at the exam question. It's really hard to do when they turn on the exam. 934, 934, 58, and 52. Five eight is a child code. Really need to go look at its mama code, which is our 5-4 code. Our differences between our 5-4 and our 5-2. 5-2 is a left heart catheterization. And a venography, where 5-4 is an angiography, and it's just a catheter placement in a coronary artery. So knowing that some codes are child and that you got to go look at the mother code, which this one's the 5-4 code, and then you compare the 5-4 to the 5-2 to see what your differences are. Let's see, are we doing a ventriculography or are we doing an angiography? We've got coronary angiography right there. I don't see anything that has venography in it. Still says coronary or angio. I don't see the word veno. So, yep, we'll get rid of any 52s, keep our 58s. Do we need to add a secondary code, which is our 362, and the radiology code on top of it? 362. Is what? 36245. 36245 is a selective catheter placement. Our 58 includes our left heart catheterization. Our 58 code does.
James is punching walls and slamming stuff, by the way, in our bedroom. FYI.
So you just need to know that this code already includes a catheterization and you wouldn't bill another catheterization on top of it. So that lets you know that B is your answer. Is that helpful, guys? What's going on? I only have experience with coding, and I have pathology and cytology. I want experience in that too. Fascinating to me. Go-kart. I'm new to medical coding. Awesome. I teach from the certification exam point of view. So it's not so much as teaching you how to medically code in the real world, doing real life situations. I teach from the exam point of view. But it's still pretty helpful, I think. There's your rationale on this one. Let's check out this next one. Without looking at the available answers, what do you guys think would be the answer for this one? If you only had the answer to look at. Let me go talk to a child really quick. He's throwing a little fit because he can't go to a football game tonight because he's in trouble. Be right back.
All right.
I'm back. What did you guys think is the answer? Some people say A, some people say B. Let's see. You're going to pick a symptom with a disease. But if we do pick a 50, the only one that has maybe it's just a symptom. I wonder if they do have that disease. Well, 3 of the answers do have the disease in it, so yeah. Maybe. The injury code wouldn't be second, it would be first if it was C. Could be D, but if 3 of the answers have this disease in it, then I wonder if it was coded before or after. All right, let's go look up our differences. 929, 50, and 60. 929, 929, 50, and 60. Ooh, 50 was on somebody's exam recently. And 60 code. What's our differences? One of them is a cardioversion, elective, and the other one is resuscitation. What are we doing? What are we doing? Are they DOA? CPR, we do see CPR. Definitely did CPR, so we can get rid of B. How many diagnoses do we have for today? We did not do that. So do we have 1 or 2 diagnoses? We have acute heart attack and cardiac arrest. So 2 diagnoses. Yep. You're correct. A is the answer. Good job. Good job, guys. Anybody got an exam scheduled anytime soon? I jumped into these lives first time after taking the membership. Will these videos be available later as I go through? Yes, they will. Absolutely. They are available. Hey, Patrice. How's my Texas buddy doing? Anybody have an exam scheduled soon? How's everybody's Friday? Y'all are so quiet today. Yes, you're right. Go kart, no C. I was right. That's a good job. Hey, Paula. I hope this was helpful. You do? Jocelyn? When's your exam scheduled? You're looking to do yours in October? There's another one. If we were just looking at the answers, what do you guys think the answer would be? We've got 2 of them that start out with 30. Then they have 34. Then it goes to another code or radiology. Radiology is in 2 of these answers. And then followed up with one more code. What do you guys think is the answer? I was doing just this one. I like D because it's just 2 CPT codes, 1 radiology, and that's it. Seeing another CPT code after another radiology seems weird. And then 36 isn't the 30 because we have 2 answers that start out with the same answer. And C doesn't start out with the 30 either. So just looking at these without seeing any of the question, I like D. As far as I know, the exam has not changed. I don't expect it to till around, like, they're going to put a hard stop on the exam around January 15th. And then they won't let anybody schedule anymore till like February 1st. And then when the exam changes, I wonder, they might have like the last 10 questions at the end be fill in the blank. But for right now, everything's all multiple choice. All right. Let's look up our codes. 37230. 37230. 37230. That is transluminal stent, but what is its mama? Its mama is a revascularization that includes, its mama is 37224. It's a revascularization that includes an endovascular, open, or percutaneous procedure for femoral popliteal arteries, unilateral. And then if we go to our 30, it includes an arthroectomy, a removal of something, a repair of something, an angioplasty with the same vessel. $36 is a balloon plasty. 21 is also a stent placement under a revascularization. But what's our difference? That's iliac and we are femoral. So where are we at? Body placement is going to be helpful with this one. So we are femoral. 20 is in the hip area. 24 and 36 are going to be in the femoral leg area. 21 is going to be in the hip, leg, leg, leg. This one is 3 pages long. Lots of nightmarish stuff to look at if you felt like it, but we already know that our 30 includes our transluminal angioplasty. Stenting, this 36140. If you wanted to eliminate that, 361, let's go look and see what that one is, because the answers for A and D are the same, except for that added code. 361. $361.40 is our needle catheter upper extremity in the artery, which is silly because, yeah, our 372. $372.30 includes 361.40 includes the femoral artery catheterization right there. Includes all that. So you know it's D. Here's our rationale for that one. Is it like fill in the blank for medical terminology? Who knows? It could be medical terminology, it could be CPT coding, it could be ICD-10 coding. I assume it'll be a mixture. Not sure. If we were just looking at these available answers, what do you guys think it'll be? I like the 2000 in 3 answers. Then would it be a 30 or a 25? You know you're probably going to have that Q code because it's in 2 answers. Then our difference is, would we have 2 radiologies or 1 radiology? So out of that, I like C just because it only has 1 radiology instead of 2. Just playing around. What's our differences between 36200 and 36215? Let's see, 36215 and 00. Selective catheterization or an introduction of a catheter into an aorta. Are we selective or are we a catheter placement? Let's check it out. What did we do? We did a pigtail catheter into an aorta. That means we went straight into the aorta and we're doing something in the aorta, right? We're not moving on and doing other things in other areas. We just, that's more of a selective thing when we do selective catheterization. So we went into the aorta, we stayed there, and we did something. So you know your A, B, or C. Then let's go look up our differences between these radiologies. 75625 or 30? 756. There's a full view, TikTokers, on YouTube if you guys want to scoochie over there. You get to see a better view with, I'm showing off the book and how you look at the differences and stuff. Plus, you could probably see the questions better, but I got to figure out how to get my TikTok stream ID number so that I can add you to OBS and do the stream directly from my desktop computer. 75625, 5625, and our 30. Our differences. Are we doing abdominal, or are we doing abdominal plus iliac femoral extremity catheterization? So we went lower abdominal, and we've got iliac bifurcation. And the 25 does not have iliac in it. 30 does. So we know that we're going to be 30. We already eliminated this one. So out of the differences between the 25 and the 30, we know 30 is going to be it. You don't need to verify that the Q code is correct or that we don't need the 16. Your point in doing these exam questions is to really find out what the answer is the fastest, most efficient way possible. Later on during your study time, you can go look up your Q code, figure out what that goes for, and how they come up with that amount, dosage-wise, right? And you can also write these examples in the book. You can go to the 36200, write this example there. You can also go to the 75630, write the example again there, and then also go to your Q code in your HIPICS book and write the example there. Just say that you did a catheterization that was non-selective, right? In your lower abdominal aorta, you did iliac bifurcation with this med and that milligram. That's it. You don't have to make it super in-depth, but making the notes in multiple places is super helpful. That way, if you see any part of this question again during your exam, you'll be able to pick out the answer quickly. I do have some anatomy questions coming up too. Alright, what do you guys think the answer is for this one without looking at the question? Thank you, Katie, for the question on TikTok. I hope this is super helpful. I've got 28 of you guys on TikTok. How many do we have on YouTube? We got 18 on YouTube and 16 likes. Fixing to give away some YouTube memberships, so if anybody wants to switch over to YouTube, you can go to Medical Coding by Jen on YouTube. I am streaming live there. And I'm going to give away 5 YouTube memberships. Those memberships will give you access to the exclusive videos that I have that are not available anywhere else. They include individual CPT book prep videos for all of my notes, at least a little bit per section, and then also for the ICD-10 guidelines, for the HIPICS also, and all these cardiovascular notes that are super cool if you wanted to know how to make those.
Very demure, very mindful.
Who's very demure and very mindful? Huh?
Have you not seen that TikTok yet?
I have
Shannon
seen
AG
that
has become a
TikTok.
member.
I have. I have.
I love it so
Is
much.
Kendall not going to the football game yet?
No, she's not going. I'm still going tonight. She's at her aunt's.
Okay, and then you're going, and who's going with you?
No, when I'm just going. My friends are already going to be there.
What friends are going to be there?
Let's see, Cadence, my sister, Let's see. Maddie's friend group. Nevaeh's going. Let's see. Izzy's going. Michaela's going.
Okay. You're going to be mindful, very demure,
Yes, very mindful.
very mindful. All right. All right. Move this out of the way. Very demure, very mindful. All right, let me bring up these notes again. And no help from me. What do you guys think the answer is? Put it in chat, please. Thanks for the follow. Thanks for the share, Val. Here is second half of this one. How many pages is this one? I think it's 3 pages. Last part. You just purchased the integumentary notes. Oh Lord, those should help out a whole lot in integumentary. The musculoskeletals were redone this year. Cardiovascular has been great. I didn't update it for 2024. There wasn't any need for it. The notes are still good from 2023. The main thing that you need in the integumentary notes, when you see them and you start writing them, you may have like a lot of writing that is over the top or around the CPT codes. You don't need that for your exam. What you do need is that one word difference that's right underneath the CPT code. That's most helpful. But the extra bonus information is there in case you wanted to know what was actually going on inside the exam or the CPT code descriptor. But don't think that you have to write everything that I have there. Just be sure to practice questions with my notes. Remember to look for those notes. Once you write them all in, don't hyperfixate on the code and the descriptor. Don't remember to grab those one-word differences and search the question for those things. A lot of people write all this and then they forget how to use them. So, what do you guys think is the answer? Did I have anybody try an answer? I got C with go-kart. What do we got on YouTube? A's. Welcome, Sharon. Thanks, Megan. Cardiovascular notes are awesome. The Appendix L alone is great. That goes along with it. You're about to take your CPT test. Oh, Katie, when are you doing it? So let's go look up our differences. 9. We've got 2 answers that start out with a 93454. 93454. 934. 54. 934 54. And then 929 20. Travis. 929 20. So 929 20 and 21 are percutaneous coronary angioplasties. 54 is a catheter angiography. What did we do? Did we do 24, 20, angioplasty, angiography. Angioplasty versus angiography. What did we do? Angioplasty. Angioplasty, distal second vessel. So 54 doesn't have our plasty in it, but our 20 and 21 does. So I would get rid of these. And then out of these two, my differences are, this is an add-on code. It would not be the first code that we would use for any billing purposes or whatever, because it's a billing code. You got to have something else to code with it if you're going to use this code. So it has to be B, because it's the only thing that has the plasty in it, right? Hey Janet, good to see you. How are you doing? Thanks for the follow. Good to see you guys. Thanks for all the taps. We got almost 4,000. One more, I think, cardiovascular one, and then we'll move on to something different. I'm sure y'all's minds are exploding. I'm not going to help. You guys go figure out what the answer is. Put it in chat. What do you guys think the answer is? Are you a 5'4" or 5'8"? Five, 4 and our 5'8". They're both left. Five 8 is a child code underneath the 5'4", which is a mama code. Yep, right there tells you that you are a 5'8". Good job, good job. So then now you're down to a B or D. Your next difference is just a 2'8" or a 4'3". 2'8", 5'9". 3. They're all going to be all out of whack. 2, 8. Stent angio versus a revascularization of an occlude. Did we revascularize it, or did we add a stent? Aw, thanks Janet for coming back to let me know you passed too because of the workshops. Congratulations. I'm so happy. That is awesome. That is wonderful. Are you already in the medical field? Did you have to have it for your job, or are you looking to get into it now? Kate, when is she taking her exam? I just purchased it. Yep. You work in ophthalmology before, so I've got a little knowledge. That's awesome. I hope you can get rid of your A apprenticeship really easily. Maybe you got a friend, somebody that will still write a letter. That's awesome. Ophthalmology in the house. Ooh, I don't like eyes. I do not like doing eye procedures. Yep, we got stent down there. Yep. Everybody got D as your answer? Good job. Howdy, love, sunshine. Good to see you again. How you doing? Happy Friday. Integumentary. How do we code for 3 benign facial lesions? I think this question, I think they call them like warts or something, but it's pretty close to what's on the exam. Today's been a really nice Friday. Getting work. Just got in from work and now getting dinner ready. Goodness, bless your heart. I forgot about, I don't even cook dinner anymore. That's just one of the things I have to let go of. Hey, Travis.
Yeah.
Will you put my blankets in the dryer for me, please? I'll never get this.
Yeah.
Can you put my blankets in the dryer and start them for me? Because I'll never get them dry in time for bed. Always been interested in medical coding, but oh my goodness, it looks difficult. Aw, no worries, sunshine. I like to teach from the exam point of view so that you can just pass the certification exam. There's no prerequisites or any kind of course you have to take. You can just purchase the exam and take it. They do allow for 2 attempts with 1 purchase at aapc certification. And then once you pass, you can get into the medical field. You don't have to do medical coding, but you can do a whole range of stuff like patient chart auditing. You can do online FEMA work or VA work, customer service, all kinds of stuff, but it just really does open up the door for a lot of people. You can work as a super user for the EHR companies that make medical record charts, and you can use your CPC certification to get a job working and showing people how to use their system and stuff. It's really cool. Lots of areas you can go into. You'll soon be an empty nester. Oh, and you need something to do. Yeah. So you don't sit there worrying your whole life around. Yeah. Absolutely. You need something to keep your mind active and learning something, keep you youthful, Yeah, absolutely. You can absolutely self-study. Get you a remote job from home, and you can even educate. I know there's a medical coding position open at my son's high school. They have a medical assisting course that they teach, and one of the people that just had that position was a medical coder, and she moved off to a different state this year, so they need another one in there. It'd be all right if it was just one class a day, but I don't want to teach 5 classes a day. Or 4. I think it's 4 classes a day, something like that. But I could do 1 a day, but not 4. My daughter will be going into the radiological science program. Awesome. That's great. Great career. Anesthesia is a really good career too. Chemotherapy, being a tech that administers the chemotherapy, is also a very, very, very lucrative career too. That's like 1 year of school and immediately right out the gate, 6 figures income, working at a radiology or a cancer center, just administering pre-prescribed and done up for you chemotherapy into IVs. So yeah, there's lots of areas you can go into. I often thought about doing more radiology. I did used to shoot x-rays way back in the day, early 1990-ish, close to the 80s. when we were running amok in the United States healthcare system, where you didn't, if you had one thing under your belt, you could do everything. We were able to shoot x-rays back then. We just said, well, we just set up the films and the patients and had the doctor come in and hit the button, is legally what we said we did. But, the doctors never did come in and hit the button. But, we were just running amok back in the day. But I've done some x-ray shooting, did spine, all the chest x-rays, L-spines, fractured foots and hands and stuff like that. I also used to draw bloods. I've delivered babies, you name it. I've done it in the healthcare field. We just kind of done everything. Once you got into it, you did everything. What did you guys think the answer was? We're in Missouri. Awesome. You failed twice, got discouraged, but I think I'm going to try again. Awesome, unknown caller. You got to watch my videos. I go over exactly what to expect, and I teach you from the exam point of view to let go of trying to prove yourself as a good coder. That's not what this exam is for. This exam is just to see if you're a good exam taker. You need to not worry about trying to prove that you are a very good medical coder. You just need to look at these answers from an A, B, C, or D point of view. What do you need from the books to tell you which answer is correct? You're going to also look for similarities if the answers start off with the same answer, but then there's just slight differences. What are they trying to quiz you on? Because that slight difference is probably a parenthetical or something in the CPT descriptor or a guideline that is that one little difference that they're just testing you on, just to see if you know how to utilize these manuals. And if we're destroying 3 facial lesions, our CPT code descriptor on that 17110 says it does up to 14 lesions, you know that your answer right away is just B. We don't have to code them each. If we had 15 lesions, our answer would then change to that. If we had 16 lesions, we do this. If we had 17, something like that. Travis, quit repeating. It's getting me distracted, dude. What? Why are you repeating the Twilight song?
That's not the Twilight song.
It is the Twilight song. That is a Twilight song.
it's not.
That is
No.
that is a werewolf song.
The fact that
Dude, I walk the red carpet with the actors in Hollywood. I know. Look at that wall. It's right there. Kristen Stewart all over. I know. I've met them all. I've had dinner with Stephanie Myers. What are you talking about? That's the Twilight song. Why are you got it on repeat? It's being distracting. Turn that off. He knows how to distract me. But Miss Patrice, this answer is only B. But I was saying we would do this if we had multiples. Like if this answer, like if we had 17, I think, lesions, that's what this answer was for. I was going on. But this one's answer for this particular question is B. That one is B. But if we had 17 lesions, this would be the answer. Does that make sense? And if we did it without the times, and we needed to do it with just the added one more, this would be 15 lesions. 14 or less, whoops, is right here, is B. So if this said 13, it would still be B. Yes, yes, yes. This is for 15, Mabel. So 16 would be times 2. That would be 16. And you can write these examples in your manual and just have a whole list of them all listed here. You know, in my manual I have, especially for those AKs that are awesome, usually always on the exam. If it's 3, it's times 2. If it's 10, it's times 9. If it's 14, it's times 13. You can do the same thing with these codes. Just write you a list of them. You want to meet Stephanie Myers? She's pretty cool. I've got so much of her swag here. Autographed books and stuff like that. Her and I had a really long conversation side by side together at Wolfgang Puck's in LA one night. We discussed adoption. She was always wanting to adopt. Her husband wouldn't let her. We talked about her new book she was writing. It was going to be a sci-fi one. Of course, she was talking about The Host. But it was cool. She wasn't promoting. She was fascinated. And we just had a cool conversation for a couple of hours. It was really neat. But yeah, I did the I've met them all the actors. Ashley Greene, all of them. Anyway, long time ago. Let's get on to another integumentary one. If we were doing xenographs, which code would we be? If similarities and looking for coding irregularities fail you and no codes are super similar, you just need to start with two codes like A and B, go to them super fast. A and C might be closer. Go to them super fast, look at your differences, look at your headers. See if you're in the right spot. If you're not, then go pick the other two codes and look them up and see if you're under the right header. You don't get the explanation for the 16. So this 11 descriptor has the word each in it. No, it doesn't. It has 15 or more. Sorry, you're right. That would be 16. That would be 16 or 99. Yeah, you're right. I was wrong. The one above it, one of the other codes on this page has the word each in it. The 17003 has the word each in it. Yeah, got that one confused. So this one could be 99 lesions, and it would be that answer. Oh. It could be 16. It could be whatever. 16 would be the 17111. Oh, totally wrong. I coded them like they were AKs at the top, where its code is an add-on code. Yeah, y'all gotta holler at me when I start spouting for no reason. Yeah, it's the ones at the top. The 17000 and the 17003. That's the one that has the each in it, and you get to times it. This one, these two codes, are not a mother and an add-on code. This is just a mother and a child code. The 17111 includes everything that is mama. And those are your viral warts. And I know there's a question on the exam about removing 3 of these. THREE. So this is a coding irregularity. It would never happen because you can't combine those two codes. So that's helpful. So is D. You would never times that one. That's a coding irregularity. So you know it can only be a difference between A or B. And then you just need to look for whether you've got up to 14 or just 15. But both C and D on this one are coding irregularities that would not happen. Lord. All right, let me see. What do you guys got on this one? No worries. I'm just a human who makes lots of errors. And plus, I'm playing around with Travis too much. I should be focused on what I'm doing. All right, we've got the 12,000s or a 13,000 or a 15. Where are our xenographs at? And let me work on those. Giving away those YouTube memberships. We've got 20 likes and 30 people on. Let me toss them some money. I'm going to give 5 more YouTube memberships out. Let's see. Fagan, Shauna, Tanya, Tracy, and Stephanie. Of course, Stephanie won. Yay! And she has a last name that starts out almost like Myers. At least it starts out with an M. Maypin. Congratulations, guys. I hope that's super helpful. I hope having access to all those YouTube videos is super helpful. We've got a couple of podcasts going where I'm reading out the ICD-10 guidelines, telling you what it means. I've done that with the E&M part of the CPT book, which is super cool. Got a lot more reading to do. You're very welcome. All right. What do you guys think is the answer for this one? We've got D's over there. We've got A's on YouTube. Or TikTok, I mean. So graphs. What do we do in integumentary when we first start out coding? So like our 100s are just needle aspirations. Then our 11,000s are just debridement. And then our 12,000s, what's going on with these? These are usually, what, excisions or something? Those are repairs. The 12,000s are repairs. What's going on with the 13,000s? 13,000s are more repairs, right? And then our 15s are under the header of. What does that header say? Autographs, tissue cultured autographs. What did we do today? Oops, didn't mean to do that. Tiki talk, there we go. We did do graphs. Ashley, you passed your exam too? Oh, congratulations. Where's she at? Where's she at? There she is. You are very welcome. I hope I made a difference. Ooh, I know I'm just like crushing the AAPC's pass rate. We're helping out a lot of people where they're not having to retake their exam a bunch of times, but not that it matters. Some people take it, you know, more than a dozen times, and that's fine. I just hope I make a difference and help out. Oh, you're very welcome. Are you already in the healthcare field working? Did you have to have it to keep your job, or are you fixing to dive into the market? Did you have the the question about the sex change, or did you have graphs on your exam? Thanks, Janet. Since we only have one code in this question that is under the header of graphs and everything else is under like repairs and stuff, you know you're doing a graph, right? Thank you so much for the glitter. Oh, she got a glitter badge. Oh, hey, Bells. How's it going? Thanks for the heart me. Thank you, Island. You guys are awesome. I got next, says Go-Kart. That's right. I'm new here and I'm currently taking my last semester of coding. Feeling awesome. I hope I can help you out to pass the certification exam. What you're learning in the course is not meant to help you pass the certification exam. Just so you know, I'm the only one that teaches how to pass from the exam point of view. Be sure to check out some of my videos. Learn how to do the process of elimination. Looking for irregularities, similarities, that kind of stuff is super helpful during the exam taking process. You've only got 2 minutes per question, so you want to get super fast on taking your exams. I've got some workshops on my YouTubes where we're doing 75 questions in 3 hours. If you can keep up with me, find the codes, and get through 75 questions in 3 hours, and you've gotten like 90% of the questions right with me, then you know you're ready for the exam. So that is super helpful, and I've got a lot of those up for free if you want to look at those on YouTube. Working with my flashcards. Aw, Bells, I just posted a new list of flashcards. Plus there's a set that you can download completely free now on my website. Those were the acronyms. Let me see. What is that? Yeah, these acronyms, they're on my website at medicalcodingbyjen.com. If you go to the practice area tab, I've got these where you can just download them and then you can print those out for free. They're down at the bottom of the practice page now, and they're just the acronyms. So pretty cool. I also have some that you can purchase that are the E&M ones, where you're looking at just the E&M code and you're supposed to know what the header is without looking in your book. So I really like those. I think those build up your confidence in the E&M section during the exam, and a lot of our questions are more geared towards E&M, so that is super helpful, I think. Has anybody got an answer for this question? What did Ashley say? She did get that question. She got it from male to female. Awesome. Fecal transplant question. Wow, that's a good one. Where's my book? Where I'm keeping some of this info down. Dinner with Stephanie Myers, and you telling me that ain't no Stephanie Myers song. That's a Stephanie Myers song. I know she didn't write it, but you know what I mean. Where is... Fecal transplant. It's only 5 o'clock. Don't start worrying me. I'm sitting here teaching them the wrong thing because of you.
No, you're not.
Yes, I am. I was all messed up a minute ago.
When do you teach anybody
What is an avulsion? What do you guys think? Peeling and shaving? No, you're not eating any more of my stuff. Go to the kitchen. No. No. You have already had a Little Debbie. And that's an extra size, king size Little Debbie. You ain't having no more. There you go. There you go, guys. B is correct. Good job. CPT code 36215 is for a selective catheter arterial system, each first order thoracic and brachiocephalic branch within the vascular family. What appendix can help you determine the order of the vascular family? I make this seem really easy to do during my lives. You guys gotta practice doing my videos without the audio on. Just turn the audio off. When the question is shown, go see if you can do it in 2 minutes flat without me telling you how to look for your similarities, irregularities, and all that stuff. Because I make it easy and you guys think you can do it without me, but then when you go to take your exam and I'm not there, shock kind of sets in. So be sure to try my videos without the sound on too. Yes, Appendix L. Good job. Rash, hemorrhages, shortness of breath, or wound infection. Which one is considered to be an adverse effect? What do you guys think? Indeed. Rash due to penicillin. Perfect. Good job. What chapter contains the diseases and disorders of nails? Perfect. Answer A. Good job. What is not an example of an active treatment of a pathological fracture? Cast changing, ER encounter, surgical treatment, or evaluation and treatment by a new provider? What is not an example of an active treatment of a pathological fracture? You're looking for an incorrect answer. Which one is not an example of a treatment of a fracture? Not. Correct. Cast changing. Awesome. What does the abbreviation CKD stand for? I think the one that's on the exam is like ERSD. They love acronyms, so be sure you know what your acronyms stand for. That one's also A. Yes. Easy peasy. Which drug? A drug which ends in the suffix PRIL is considered what? An antiviral, an ACE inhibitor, a beta blocker, or an H2 antagonist? C's and A's. It's ending with? Yeah, he does. Go help Grandma so she doesn't have to get in and out. It's an ending, not the beginning. B, ACE inhibitor. Don't know if a lot of people got that one correct. Aaron, oh my gosh, another one? That's like 4 or 5 today. Aaron, I'm so happy. I just wanted to let you know that I got my first job interview on Monday. I passed my exam last week. Your videos helped so much. Yay! That's awesome. Congratulations. I'm so happy and proud of you. Awesome, awesome, awesome. I cannot wait. Keep us informed. Let us know how the job is going. I hope you love it. I hope it's everything you've always wanted. You can go to Pharmacy Tech Study /drug suffixes to find a full list of drugs if you wanted to download it. It's pretty cool. Which respiratory term is defined as voice? Good job. Yes, D is it. Good job. Here's the answers for all of them. When a physician performs a left ventrography, the catheter is placed into the left ventricle through which heart valve? Are we doing mitral valve, pulmonary valve, aortic valve, or tricuspid? You can find that answer in your CPT book on the heart picture. You can see which valve. They've got them all listed and stuff. You can find it there. For coming in on the left, if you've got your stuff marked left or which one's right, that helps too. left ventricle. What valve is right above it if we're left ventricle? What valve is that right there? It's labeled. And this is left ventricle. There's the valve. And we're labeled right there. Aortic valve. Yes, yes, yes. Knowing how to use what's inside the CPT book is mainly what they're quizzing you on. Which additional procedures are used to measure the pressure difference across the coronary arteries stenosis? Do they use an ultrasound, a graphy, a reserve, or a placement? Thank you guys for the 12 shares and all the taps on TikTok and the gifts. Still got 17 of you guys on there. I hope y'all's Friday is going great. We got 32 on YouTube. Good to see everybody. We're doing flow reserve, right? Checking to see which veins or arteries or whatever are restricted. 16-year-old in the office with an ankle injury. And they overstretched the ligament. What is that called? Is that called a sprain, tendinitis, atrophy, or sprain? Oh yeah, guys, I forgot. I totally forgot. I've got something to show you guys too. Totally forgot. I've been sitting here waiting. It's a windshield cleaner for the car. I know. Boring, right? Sorry. Y'all on YouTube. Oh my gosh, I forgot to show you guys. Let me get this up where you guys on TikTok can see too. Hold on. Totally forgot. Totally forgot. I waited so that I could show you guys. I got something in the mail. Besides the cease and desist letter that I got, but we won't discuss that. I got something in the mail, and I can't flip it over because it's got my address on there twice. But, I don't want to dox myself. But, hold on. Let me open it. I have not even opened it. Let me open that. And let me open this side. Okay. Open one more. This side right here. Oh, I picked a different song to listen to over and over and over again. I got the YouTube-y thingy, whatever they do, the placky thing, the wall placky thing, for medical coding by Jen. We got 100,000 subscribers on YouTube. Isn't that cool? So now I got this little placky thing to hang up in our house. Isn't that awesome? Never would have thought, ever. And I can't get, 2,000 people to watch me on Instagram, but I can get 100,000 on YouTube. That's crazy. It's so funny. And if you ever wanted to know, the views, like people watching my views, earns about $3.20 a week, in case you ever wanted to know what 100,000 subscribers would pay out. But it's better than what TikTok does. But yeah, I got the little letter. It says congratulations and a wall plaque. They sent it all for free. But isn't that cool? I also got a free pizza from Domino's from them last week, so that was cool. Silver Creator Award. That's what they call it. Yeah. To do next, you got to reach 1 million subscribers. That's crazy. But if you look up all the other medical coders that are on YouTube, I'm like number 2 worldwide. There's one more that's got more than me, but that's it. So that's pretty cool as far as subscribers go. But thank you guys so much for hitting that subscribe button on YouTube and got me that. My kids are quite impressed with that. They just think that's crazy that their mom has 100,000 subscribers on YouTube. Thank you. You guys are awesome. Thank you, Island. All right, this one. Overstretching your ligament is called a sprain. And I think they ask questions like what attaches bone to bone, something like that, usually on the exam. What about these? Are these considered benign, AKs, malignant lesions, or decubitus lesions? What kind of lesions are these? Isn't that awesome? I know, I was like posting on TikTok for like 2 years, and my oldest son is like, you should be posting these on YouTube. I'm like, no one's going to want to see anybody on YouTube. I thought YouTube was like this old thing that nobody did anymore, that everybody was on TikTok. So then I transferred the videos over to YouTube, and it really took off compared to TikTok. Like TikTok only have like 35,000 followers or something, and Instagram only have 2,000. But 100,000 on YouTube is crazy. Happy Friday, that's right. Hey Taylor, how's it going? You can rewind it and rewatch it. Patrice says B. Where are warts? Where are we when we coded warts? Great, Taylor. When I was making all those errors and telling y'all the wrong thing to times the code when we weren't supposed to be timing it, where were we at? Where were we at? Yeah. We were benign lesions. Go write these names down. beside that word. Beside that CPT code, I mean. Dermal regenerative grafts are best described as what? Chemical peels, removals, like with sandpaper, replacement dermal of cultured tissue, or full thickness tissue partially attached to the body by narrow strips of tissue. What are we talking about when we're talking about dermal regenerative grafts? What's going on? Yeah, it has the word in it, which is super helpful. Yep. All right, we almost got 2 hours in. Let's do one more. I forgot how many pages this one is. I think it's 2. We've got another case. This is in female area. What's our differences between our CPT codes? We've got 2 of them in the 5.8 section, 1 in the 5.7, and 1 in the 5.4. They all have the same radiology and all have the same diagnosis code. Here's the rest of that question. We did fluoroscope. We don't have to worry about that. We don't have to worry about the diagnosis because it's all the same. What did we do with these tubes? What's the differences between these codes? C is our unspecified procedure. Five, 4, 2. 5, 4, 2. Are we even in the female area at our 5, 4, 2? Lord, 5, 4, 2, da, 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 da. I think we're in the male genitalia system, so I don't think we're D. The next code is 57180. I'll just do them in order of lowest to highest. 57180. 57180. We're doing an introduction on that one. Our 5834. 58340. 58340 is also under introduction. Introduction. 58999. That's got to be non-specific with all those nines. 89999. Yeah, unspecified other procedure. What's our differences between the 87180 and the 83840? 83840 is here, and then our 87140, we're doing cap a pack. Got a patient who's hemorrhaging, and then the 8340 is histography, splenohistography, spleno latches. Poor baby could not carry a tune in a bucket. What do you guys think? Yes. A is correct. Good job, good job, good job. Yep, yep. They love using things that are under the same headers. Repair in one section, repair in another section. But you need to know what body part you're dealing with. That makes things a whole lot simpler. 571 is a pack for spontaneously hemorrhaging, trying to get it to stop bleeding, where our other one is the actual procedure for removing. Yep. That SIS procedure is what they call it. If it had a header, they would call it an SIS. Very cool. But I hope this was helpful. We're going to go to a football game. Travis is not cheering. He's just going. It's a different team. They have a junior varsity and a varsity team. Tonight it is the varsity team that's playing. Travis on the junior varsity team because he's still in 10th grade. Next year, 11th and 12th grade, he'll be on the varsity team. So he's just going to support the other girls on the team. So we're going to go to that. You guys have fun. I hope this was helpful. Sorry about the mistakes about those integumentary codes, but we figured it out and got it going towards the end there. We will do 2 more hours of lessons on Monday for sure. When do y'all want to have a workshop this month? I need to schedule one. Probably could do it on the 15th or the 22nd. Either one. I don't think I have anything going on. And what do you guys want it to go over? Do you want to just do E&M and guidelines, or do y'all want it over every section, like a few codes from every kind of all 18 sections of the exam? What kind of workshop do y'all want this month? Do you want just cardiovascular or all E&M or all of the above? Any suggestions? Which date do we want to do it on? The 15th or the 22nd? Andrea says every section. Every section, so does Taylor. Anybody on TikTok want to chime in? Yes, all in order of the test. All of the above. Okay. Yeah, my last one was a little bit out of order. Some of the questions went from one section to another. Y'all want it in order like it is on the exam. Okay, can do. Hey, Brittany. I'm late. That's okay. You can rewatch it. You take your exam on the 22nd, so we need to have one before then. How about the 15th? Okay, we can do it on the 15th. I'll go schedule that now. We'll do a few questions from every section in order, just like the exam. Okay, all right. I'll go put that up. Thank you guys for the help. Thank you guys again for the award. Sammy, you trying to eat the box. He's trying to eat the box. Now I got a shiny little plaque to hang up. Thank you again so much. That is awesome, guys. Looky there. Isn't that awesome? Got me a YouTube plaque. That's awesome. They're wanting to do a one-on-one video with me. They're willing to pay for the hour, $75 an hour, to do a one-on-one with them. Something about AI generated videos. I think it's because some of my videos, I say they're AI generated because I use an AI app to help me create the graphics or something with it. And so I mark it as partially AI whatever generated. So I guess they're wanting to know about how it's going and stuff. So anyway, I may do that if I ever have the time. We'll see. But it's kind of cool. What time on the 15th? It'll be 2 o'clock Arizona time zone. So for right now, it is 5:20 here in Arizona, and this is when we would end our live. We'll do 3 hours starting at 2 o'clock on the 15th. We'll do 75 questions in 3 hours. I'll find 75 questions I've not done on a workshop before, and we will do that on the 15th. All right, guys. Proud of you guys. Love you guys. Thanks so much for all the taps and shares and the messages on the videos. That really does help. Let me know on any of the videos on TikTok or on YouTube what you want to see. Give me a suggestion, because that inspires me. I'm like, oh yeah, I can make a video on that, and then I'll go do that really quickly because I never know what to make. I'm like always unfocused and just all over the place. So if you guys have a suggestion, like what's the difference between these two modifiers, or what's the difference between these two codes, or something, anything, you guys, that helps me out stay focused and create videos on what you guys need help on. So thanks, guys. We will see you on Monday. We'll do 2 more hours of free lessons, and the link for that is already up on YouTube. So I think I put it at 4 o'clock Arizona time zone. So I will see you guys then. I hope this was helpful.